The way of learning. Today's topic is white blood cells exhibited for staff nurse interns. Next one is detection of which immunoglobulin by photosynthesis indicates intrauterine infection. Option A immunoglobulin G, option B immunoglobulin A, option C immunoglobulin M, option D immunoglobulin E. Correct answer is option C immunoglobulin M. Next one is which one is major immunoglobulin in human serum and is responsible for protection of body fluid. Option A immunoglobulin M, option B immunoglobulin G, option C immunoglobulin E, option D immunoglobulin A. Correct answer is option B immunoglobulin G. Next one is which antibodies elect first when an antigen is administered for the first time to a human. Option A immunoglobulin G, option B immunoglobulin A, option C immunoglobulin M, option D immunoglobulin E. Correct answer is option C immunoglobulin M. Next one is which immunoglobulin can cross the placenta and provide passive immunity to newborn. Option A immunoglobulin G, option B immunoglobulin E, option C immunoglobulin M, option D immunoglobulin A. Correct answer is option A immunoglobulin G. Next one is all of the following antibodies can cross the placenta except option A immunoglobulin E, option B immunoglobulin G, option C immunoglobulin M, option D immunoglobulin A. Correct answer is option C immunoglobulin M. Next one is immunoglobulin found in a mother's milk is option A immunoglobulin M, option B immunoglobulin A, option C immunoglobulin E, option D immunoglobulin G. Correct answer is option B immunoglobulin A. Next one is a rise of an exciting antibody level in response to irrelevant stimulus is called option A anaphylactic reaction, option B anamnestic reaction, option C agglutination reaction, option D precipitation reaction. Correct answer is option B anamnestic reaction. Next one is the thymus related T cells. Option A produce antibodies, option B produce NK cells, option C recognize B cells, option D recognize body's own cells. Correct answer is option D recognize body's own cells. Next one is which one of the following set of cells are all antigen presenting cells? Option A macrophage, plasma cell, B cell. Option B macrophage, eosinophil, dendritic cell. Option C B cell, macrophage, dendritic cell. Option D cytotoxic T cell, dendritic cell, B cell. Correct answer is option C B cell, macrophage, dendritic cell. Next one is T lymphocytes are involved in option A humoral or antibody mediated immunity, option B cellular or cell mediated immunity, option C both of these, option D they do not produce immunity. Correct answer is option B cellular or cell mediated immunity. Next one is T cells mature in option A thymus, option B liver, option C spleen, option D kidney. Correct answer is option A thymus. Next one is one of the following cells is responsible for cell-mediated immunity. Option A, T lymphocyte. Option B, B lymphocyte. Option C, plasma cell. Option D, beta cells. Correct answer is option A, T lymphocyte. Next one is antibodies that are produced by option A, plasma cells. Option B, erythrocytes. Option C, monocytes. Option D, basophils. Correct answer is option A, plasma cells. Next one is which of the following is not true in reference to B lymphocytes? Option A, responsible for production of glycoproteins. Option B, provide humoral immunity. Option C, they mature in bone marrow. Option D, provide cellular immunity. Correct answer is option D, provide cellular immunity. Next one is humoral immunity is mediated by option A, natural killer cells. Option B, T lymphocytes. Option C, B lymphocytes. Option D, suppressor T cells. Correct answer is option C, B lymphocytes. Next one is humoral immune response is characterized by option A, increase in cytotoxic T cells. Option B, increase in immunoglobulin E levels. Option C, production of antigen specific antibody. Option D, production of memory cells. Correct answer is option C, production of antigen specific antibody. Next one is which immunity is affected by HIV infection? Option A, natural immunity. Option B, active immunity. Option C, cellular immunity. Option D, humoral immunity. Correct answer is option C, cellular immunity. Next one is the chief regulator of immune mechanism is option A, plasma cell. Option B, helper T cell. Option C, B lymphocyte. Option D, suppressor T cells. Correct answer is option B, helper T cells. Next one is helper cells belongs to option A, macrophages. Option B, B cells. Option C, macrocytic. Option D, T cells. Correct answer is option D, T cells. Next one is superantigens are the antigens that activate a large fraction of option A, immunoglobulin A. Option B, B cells. Option C, immunoglobulin G. Option D, T cells. Correct answer is option D, T cells. Next one is which one of following is pan T cells maker? Option A, CD1. Option B, CD3. Option C, CD4. Option D, CD8. Correct answer is option B, CD3. Next one is when the body is able to make its own antibodies by having disease and recovering or by vaccination, it is known as option A, acquired immunity. Option B, passive immunity. Option C, active immunity. Option D, passive acquired immunity. Correct answer is option A, acquired immunity. Next one is which of the following is not the way to acquire active immunity? Option A, exposure to the disease. Option B, antibody transmission. Option C, exposure to subclinical infection. Option D, vaccination. Correct answer is option B, antibody transmission. Next one is immunity develops. Option A, when antibodies are present. Option B, on exposure to contagious disease. Option C, after having an inflammatory illness. Option D, when resistance is low. Correct answer is option B, on exposure to contagious disease. Next one is active immunity is mainly acquired through option A injection of antisera, option B from mother to fetus through placenta, option C injection of gamma globulin, option D attack of disease. Correct answer is option D attack of disease. Thanks for watching. Like, comment and subscribe the channel.